My name is Dr. Dean Sloan, and I'm a family physician in practice for almost 30 years. For the last 15 years, I have focused my practice exclusively on the treatment of excess body weight and its associated chronic diseases. I treat these conditions by the use of what I like to call lifestyle medicine, meaning I prescribe lifestyle programs for patients to follow, meaning how to eat properly, how to exercise properly, for the reduction of their excess weight and the reduction of the severity of their diseases. The resulting programs are designed in the context of their lives so that they are practical and sustainable. Oasis is an acronym for Overweight and Subsequent Illness Solutions. So essentially it means that we provide solutions for excess weight and for the illnesses that are the result of excess weight, which are very common and very chronic and numerous, such as high blood pressure, diabetes and prediabetes, high cholesterol and triglycerides, gastroesophageal reflux disease, also known as GERD, sleep apnea, degenerative arthritis in the lower back, in the lower extremities like the hips and the knees, even depression. There are many other conditions, but these are probably the most common that are associated with excess weight. So at Oasis, we treat these conditions, but not with dieting, not with the traditional approach to weight loss, which is to do something that is difficult and always temporary. I mean, when we go on a diet, we know we're going to go off of it eventually, and so if we do achieve some results with a diet, they're going to be temporary, unfortunately. And the problem is that excess weight and its associated diseases are permanent problems. So if you have a permanent problem, you have to treat it on a permanent basis. And so it has to be lifestyle based and not a diet. Beyond lifestyle though, which has almost become cliched, people say, yeah, doc, I know it's not a diet, it has to be a lifestyle. I use a word that you don't hear too much. I call it an identity. I want people to develop the identity of a thinner, healthier, happier person. I have done this personally, and it has been transformative, and this is the mentality and the philosophy that we are espousing and trying to promote and teach to our patients. It's not an easy transformation. It takes time, but of course the whole process is one day at a time. But over time, people can actually develop a new way of looking at themselves. They have a new identity. It's almost like adopting a new religion, and it has to be that important to you. It has to be to the core of who you are. And so when you decide that you are going to be a thinner, healthier, happier person, that is your destiny, that is your future, and that is who you are, your thoughts become a vision, your vision is converted to a plan, you follow the plan one day at a time, and you eventually become, in reality, the person that you visualized when you first embarked on this journey. My mission is, as a friend of mine likes to remind me, I want to save the world. Obviously, I can't save the world, so I'm happy to save individuals. And it may be a lot of people, and it may not be, but I really want to help as many people as I possibly can, not just to lose weight, but to transform themselves from a person who may be overweight or obese, who has chronic disease that's associated with the overweight state, who is just unhappy with who they are, how they feel, how they look. I want to help as many people transform themselves from that individual who is unwell, unhappy, etc., to somebody who is healthy, who is happy. And I feel the work is really important to the practice of medicine, and it's different from the traditional practice of medicine because when I was in primary care in regular family medicine, I was taught to diagnose and treat disease predominantly by the prescription of medications or referral to specialists who could do more technical things with the patients than I could. But I discovered and realized over time that these treatments were mainly Band-Aids. They weren't really getting to the root cause of the problems that people have. The root cause of the problems that people have really is in their daily routines. It's in their habits. It's their lifestyle. How are they eating? How are they sleeping? How are they exercising, or what type of physical activity do they do? How are they thinking? What goes through their head? What are is their emotional state, their thought patterns? What are their plans for the future? So we really need to be holistic about our approach to people and get into their daily lives and improve their lifestyle habits. This is how you build health, and healthcare really should be about this aspect of taking care of people, and not just diagnosing and treating disease and prescribing medications or performing procedures to treat those diseases. Certainly those services are necessary, but we are, in our society and in my profession in medicine, I believe that we are ignoring the root cause of most of these problems, and therefore the solution, and that is lifestyle. So medicine needs to branch out, needs to expand its horizons, so that we're not just diagnosing and treating diseases, which are kind of the symptom or the end result of an unhealthy lifestyle, but we must focus on a more holistic approach where we address lifestyle, we address the food, the exercise, the sleep, the emotions, the thoughts, everything that happens in an individual's daily routine, because these are the things that can either produce health or disease, and these are the things that in the medical profession we must start focusing much more upon. My message to people is that if they have issues, if they have excess weight, if they have chronic diseases such as high blood pressure or diabetes or high cholesterol or heart disease or even cancer, that the treatment of all of this is not something temporary like a diet. It is not just to go to doctors and get medications to treat these various conditions or undergo procedures to treat these various conditions, but it also involves, and really should be primarily involving, an adjustment of their lifestyle, meaning the changing in a better way of how they eat and adding regular exercise that's started gently and then gradually progressed into their lifestyle, and also changing the way they think about themselves and their place in the world, so that we can create a foundation of health. Creating a foundation of health is the opposite of disease. So when you give your body a chance to be healthy, then you can certainly prevent disease, you can certainly reduce the severity of disease, you may even cure disease. I believe the most important factor in determining a person's health versus disease is lifestyle, meaning what you do on a daily basis, all day long, 24 hours. What are you eating? What physical activity are you doing? How are you sleeping? How are you thinking? What is your emotional state? What are your thoughts? Now, nobody's perfect, but we all can improve. And my job is to give people the advice that they need to improve every aspect of their daily routine, so that we can truly build health. And when we build health, we are preventing disease, we are treating disease, we may even cure disease. Certainly, traditional medicine has its place. We do need medications, we do need surgical procedures and other interventions, definitely. But to rely solely upon those modalities for the management of disease is to miss the boat. I call this lifestyle medicine, and that is what we do here. It's a great question. Do you need a doctor to help you with your health and fitness? Not necessarily. I believe that this kind of work can very easily be provided by what we call mid-level providers, nurse practitioners, physician assistants, registered nurses. You don't have to have a doctor to prescribe lifestyle approaches to the treatment and prevention of disease, but it helps to have physicians involved, at least in a supervisory role in the facility where this advice is being administered, because we are dealing with the management of diseases, and medications may have to be adjusted, generally reduced, when people improve their lifestyle habits, and their diseases improve. And there's a lot of discussion that has to be conducted between healthcare provider and patient in terms of evaluating these various diseases and how best to treat them in the context of this healthier lifestyle approach. Almost 7 out of 10 American adults are overweight, and half of those folks are actually obese. So this is an epidemic. There isn't any other medical condition. And by the way, the American Medical Association does recognize obesity as a disease. That has been now for 2 years. There isn't any medical condition that comes close to affecting the number of people that overweight and obesity does. And not only is it a disease unto itself, but it can cause and or worsen almost every chronic disease that we know. High blood pressure, diabetes, high cholesterol and triglycerides, heart disease, cancer. Many people don't even know this, but there are many common cancers whose incidence is much greater in people who are overweight than in people who are normal weight. So we have this huge problem. And the solution in this country is diets. It's all we have. The medical profession hasn't taken a very active role in treating overweight and obesity because our education traditionally has not included any information for us on the evaluation and treatment of overweight and obesity. Eating properly, we are exercising properly, we are building health. This really is the only solution to the obesity epidemic in this country.